first special test is something you guys probably have done before. It's a straight leg raise test. You can put your legs straight. It's done basically there's a few different ways to bias different nerves. And I'll go over that in a second. So, you guys may have done this test to look at, I don't know if you've looked at lumbar radiculopathy or just general hamstring tightness or hip mobility, right? So obviously everyone knows this stretch where you pull the person up, oh, you got tight hamstrings. Well, it might not be tight hamstrings, it might be some neural tension that they're experiencing in the back, or they might, if they're really acute, they might have a disc herniation, which is pressing on some of the nerve roots that are coming on and then going down into the sciatic nerve distribution, down the posterior part of the leg, and maybe even to just anterolateral part of the lower leg too, sometimes even the heel. So you gotta think of your nerve roots for the sciatic nerve, where their dermatomal patterns would show up there as well. So tell me about your symptoms. Do you get
like stuff? A month ago I had like a kind of back injury deadlifting, and like I guess if I try to dorsiflex my ankle, sometimes I feel like tightness up.
Tightness up. Okay.
All the way up into my lower back. It's
kind of he might be dealing from some neural tension, right? So if we dorsiflex, we're putting that dura or even some of those nerves on extra stretch. You guys, can you picture that if we do that, right? Have you guys messed around with that at all in other classes like upper extremity with some upper limb tension test type stuff? Okay, good. So same kind of idea. It's not a lower extremity tension test, but it sort of is. I mean, it's not called that, but it sort of is. So if he gets that, do you get it now?
No, if I raise the leg and then do it, I get it.
So perfect, right? That's exactly the test we'll go over. So first thing, we'll have him lay with no pillow. And the reason is we don't want to have his cervical spine flex, or we could put some extra tension on the entire spinal cord there, right? So we want him in a neutral, like anatomic position. He's just going to be totally relaxed. All you're going to do is take his leg up, see when his symptoms start. Have they started yet? Okay, good. Once you get past about 70.
I feel like right there.
Okay, so what would you say that is, 70 or so?
80.
80. Come back. So if they get pain past 70, we'll talk about what that is in a second. But usually, pain for sciatic nerve distribution is between 35 and 70 degrees. That's when the most tension and stress happens. So in clinic, you'll get people that come in and they're like, oh man, you know, I have this radiating pain down my leg. You go to lift their leg, they're good, they're good, they're good. Crazy painful right here, and you come back down. So a way we can, before we deal and dive into kind of what you would look for in your assessment, let's just go over the test a little bit more. So to elicit some further, if you can't elicit with just your straight leg raise test, you can start throwing in these little drivers of tension to try to elicit a response there too, right? So the first one we do is have dorsiflexion and then go up and observe when he gets,
Yeah, I feel that there.
so much less of an angle there, right, with that tension. And what we would do in clinic is we would do it once without the tension, come up, he tells me where he gets the symptoms. I'd measure this angle of hip flexion. And then we do it with the ankle dorsiflexion, we'd measure his hip flexion. And then we could do something like this where we dorsiflex and then have you actively do it cervical neck flexion and then come up and do the same thing.
Feels a little more intense.
A little more intense. Is it going down your back at all too? Or is it just kind of in this area?
Yeah, it goes all the way up. Not all the way, but above the hip.
Okay, so there you go. So he's feeling it up into his buttocks and hip and maybe wrap around. So the big thing with this is a great way to diagnose neural tension and disc pathology or nerve root irritation, any neurological symptoms. It also could be a way to assess SI joint stuff. So if they have pain when you lift up, so let's just go to this side, maybe you don't have symptoms here, but if they get pain up into this range, which is past 70 degrees, then you can go into our bilateral straight leg raise test, which I guess you guys haven't gotten into that yet, huh? Bilateral straight leg raise test is you're going to take both his legs and then lift both at the same time and see where he gets tension. Right there. So with him, he's positive, so he might not be good for this test because we already know he's positive with this. But if you're lifting both legs and they get pain before 70, that could be SI joint, so then you can dig more into that. Or if he gets past, it could be lumbar spine joint-related pain, like arthropathy or something like that.
Camera job.
Which one's that? The butt in the air or the chest in the air?
I think that's
Butt in the air? No, I think upward dog. So extension-based stuff usually works pretty good for disc pathology patients. So you can, like if he had this, what I would do, or any other neurological stuff, I'd have him do a prone prop on his stomach for a little bit and then retest this to see if we could either gain more motion or decrease the symptoms within that same motion. See if we can elicit a response, decrease some neural tension or some stuff like that. You guys want to practice those two? Oh, one more thing. There's a cross straight leg raise test as well. So when you lift this one leg and he gets symptoms on this side, that's called the straight leg raise test. You're going to do this on both sides because you want to get an idea of his range of motion and his tissue quality and stuff like that. But if you go to lift his non-affected side and he gets pain, then you're dealing with something a little more serious, and it could be what's called a medial disc protrusion instead of a lateral disc protrusion. So you could have a little more issue there as far as maybe more surgical intervention. It's not as great as outcome. So if you lift his non-painful side and he gets pain down this leg, that's a worse outcome for him. We can dive into that too if anyone has questions about that.
So you guys can, and I'll write these on the board, so you can remember that with SID. Sural, inversion, and dorsiflexion. Okay? So then for the perineal, what are you guys gonna do?
Dorsiflexion and eversion.
Plantar flexion, inversion, P, perineal nerve, inversion, plantar flexion, PIP, PIP.
Okay? And then for the tibial nerve,
Tibial starts with a T, right? So we're talking about TED. Tibial nerve, TED.
it is like,
T,
I know, right?
T, E, and D, dorsiflexion.
Okay, so you guys, when you guys are here, you're gonna do the straight leg raise and the cross straight leg raise and bias by the nerves and see if the response is different. Okay?